Hello there, I'm Tony Meekum, and this is a lecture on principles of radiographic interpretation, probably the most important lecture in my course because everything we teach after this builds on what you learn here, so pay close attention. And why does this matter? Well, for two reasons, and to quote Mahatma Gandhi, a correct diagnosis is 3/4 of the remedy. If something's missed or misdiagnosed on a radiograph, treatment is either going to be delayed, incorrect, or in some cases unnecessary completely. So misdiagnosis is also one of the most common reasons for dental malpractice claims. But second, image interpretation, although not equivalent to diagnosis, is the first and oftentimes the most important step. In many cases, your image interpretation is going to direct the rest of the diagnosis. And so you don't have to be perfect, but you do have to give a reasonable description and differential. That's the standard. And that's what we're going to spend this whole topic on. And so a few quick abbreviations. WD, ID is for well-defined, ill-defined, CORT for corticated, NC non-corticated, RORL radiolucent, radiopaque. You can find the rest of the abbreviations that we use in my study guide. Pause this if you need to, refer back to it, but I'm going to use a lot of abbreviations throughout this course, so it's good to start recognizing those. All right, I want to start with something a little different today. You may recognize this if you've seen it before, or you may have seen a similar video.
Count how many times the players wearing white passed the ball. The correct answer is 16 passes.
So 16 passes. Did you count it correct?
Did you spot the gorilla? For people who haven't seen or heard about a video like this before, about half missed the gorilla.
So did you see the gorilla? So there was someone in a black gorilla costume that came walking by. If you were so distracted looking at the players wearing white, you may have missed the gorilla. And even if you did see the gorilla, you may have missed that the curtains were changing color in the background. They changed from reddish to more of an orange color. And so what's the point of that in a radiology lecture? Really, it's attention to detail. When you look at a radiograph, you tend to see what you're looking at and miss everything else if you're not looking for it. When dentists do this constantly, they look at the tooth they're worried about, maybe a couple of teeth around it, and they never look at the rest of the image. The maxillary sinus, the nasal cavity, the inferior alveolar canal, the soft tissue shadows, all that stuff is on every panoramic radiograph, and unfortunately, most of it gets ignored. And when we're talking about cone beam CT, that's a whole lot of additional information. Now you're talking about the whole skull base, and instead of just a single image, you've got an entire volume that you've got to scroll through. And so think of a CBCT like you're watching a movie. But even if you're just looking at 2D and pano, whatever radiograph you're looking at, you've got to be scanning for that unseen gorilla. Look for something that you might not first spot. Okay, this next slide is a quick one. 9 seconds to spot the cupid. Look in this picture. Where is the cupid in that image? I like this one because the first time it really got me. I spent more time than I want to admit looking for this cupid until I realized the man's face from the side is the cupid. So once you see it, you can't unsee it. Here's the cupid right there. And this is a good example of how our brains organize what we're looking at. We see a face, so we stop looking for anything else. We think, oh, maybe there's a little tiny cupid somewhere in his hair or in the suit coat. But once you see it, it's pretty clear. One more here. The effect of context. So read this top row here, A, B, C, D, E, F. And then read the bottom row, 10, 11, 12, 13, 14. Pretty clear, right? And so if I ask, what is this character right here by itself? You may initially just say it's a B, or is it a 13? Let's go back. It could be either. It depends on context. And so this matters in radiology because everything you describe is contextual. A lesion that looks opaque in one setting may look radiolucent in a different setting. So something that's fluid dense in the body is dark compared to soft tissue, but bright compared to air. So the context of what surrounds it is part of how you interpret it. Okay, here's a framework for everything we're going to do. At the base, we have anatomy. You see that in my mind is kind of the base of all radiology, and that's why I spend so much time on it. If you can't see and identify anatomy, nothing else is going to work. Next is going to be variance of normal. Anatomy varies. You need to recognize what's a variation versus what's pathology. If you know normal and can recognize normal anatomy cold, then anything abnormal will jump out to you, especially when something asymmetric. Your eyes should get drawn to the side that doesn't match. And then the next point, and this is what we're going to do today, is describing any abnormalities. That's what this whole topic is about. Describing accurately is what leads you to produce an accurate differential. But notice the differential is at the top. It's the smallest piece. But you don't get to that without doing the work below it. And speaking of doing the work below, if any of you are not familiar with Karate Kid, this is Daniel's son. He wants to learn karate because he's being bullied at school. Mr. Miyagi reluctantly agrees to teach him, but for weeks all Daniel does is menial chores, sand the floor, wax on, wax off. Daniel gets frustrated. He's not learning anything. But then one day, Mr. Miyagi decides to teach him that he's been learning karate all along. He tells him, sand the floor, wax on, wax off. And Mr. Miyagi starts throwing punches at him, and Daniel-san learns that these motions that he's been learning are actually helping him block kicks and punches, and he's learned karate the whole time without knowing it. And that's how I kind of think of this lecture. You've learned the anatomy, you know how to recognize things on radiographs, and now we're going to talk about describing it and how that actually applies to diagnosis. Of course, when I'm grading a test question, the usual experience is more like this when Daniel shows up and has to face off against Johnny. That's kind of like students arguing, no, it wasn't a dentigerous cyst. It looked more like OKC or an ameloblastoma, but we'll get there. At the end of this course, when you see a lesion you don't recognize, hopefully your mouth starts producing description before your brain is caught up. That's the goal. And so here's what we're going to do across this topic. We're going to talk about how to look at a radiograph, how to spot what's abnormal, how to describe what you see using a framework that doesn't let you miss anything. In the next module, I'll introduce you to that framework. It's an acronym called LESIONS, and it's the spine of this whole course. So see you in the next one. Thanks.